Have you already registered? If not, then quickly.
Dear viewers, a very warm welcome to our today's format, Visite. How fast is a week gone again? I don't think it's fast, it's just so deeply filled with all the things that each of us needs. And so I have again read through the requests in advance of this program, and thank you very much that you design this format with so many valuable hints, but also your requests, and that we take this time for each other and let you live like that. I have received a request from a family that writes, "Our daughter is 17 years old. She has had therapy-resistant epilepsy since she was 4 years old. At the moment she has a status of epilepticus once or twice a month, which means that she has to be treated as necessary every time. She takes strong drugs that actually do nothing, although she already takes 3 different drugs. We recently had the amino acids tested and we were shocked to find that most of them were very high, but others were also very low. Because of this information, we have allowed you to ask for advice and are now very desperate. I have chosen your request because it clarifies a general problem of our medicine today. That we treat an illness very strongly, very structurally, according to appropriate guidelines. It is not about the affected person, but about the illness and what we achieve with the medication. Then, if there is a positive effect, this medication is allowed. But every drug is a chemical. And if I intervene in the huge self-regulation of my organism, which is so delicately coordinated, then I need to know what drugs have to do with the course of an epilepsy. For those viewers who may not be familiar with the picture of the disease, epilepsy is a kind of impulse discharge of nerve cell groups in the brain. This means that they are either increased or inhibited. This means that the physiological stimulus has to be adjusted very carefully and very individually by the body in the corresponding situation. And the body has a sophisticated neurotransmitter system. These are substances that adapt very well to each other on the basis of brain health. If these symptoms of hyperirritability occur, the so-called irritability potential within the cell changes to the sodium and calcium channels. And so-called glutamate receptors carry a very strong activity. And the opening of the calcium channels then reduces the irritability potential of the nerve cells. This functional, I would say, reduced functional ability then arises in the long term. Or the body responds to this by a hyperirritability. Today we know that epileptic seizures can actually be triggered by many different causes. These causes are also called triggers, and it is often not just one, it is the summation of many. For example, when the body is exhausted, when it lacks sleep, when it is hypoglycemic, when it has physical and psychological stress, when heat and cold dissipate, when there is flickering light. Food components that contain a lot of sodium glutamate, caffeine, and there are really a number of environmental toxins that we know today, so-called neurotoxins. Like mercury, like aluminium, like cadmium, and many others. But your request is a different one. And I assume that all these causes do not have an appropriate place in the context of diagnostics. Because an epilepsy is of course neurologically clarified by EEG and by various brain CTs, but in the end you are quickly getting a freedom of approach in order to ultimately adjust people to this anti-epileptic. But by adopting this anti-epileptic, it can in turn lead to so many micronutrient imbalances. Which in turn reinforce the problem or the disease picture of epilepsy. And do not clarify it either, but rather reinforce it. And I recognize a very typical course here, and believe me, you are not the only ones, where we see today in medicine the many alterations of drugs, and the many new symptoms that have arisen as a result of this, often in no way agree on which derail. We doctors, on the other hand, provoke and produce for the corresponding organism. And to all my colleagues, a very valuable note: Uwe Grogger, pharmacist in Germany, has written various books about the alterations of drugs and the influence on micronutrient deficiency. And I ask and urge you all to take responsibility immediately, because a patient cannot know what damage or derail we really have to take responsibility for with this drug. In particular, the active ingredient phenethylamine is very widespread, and it is certainly there. You have written me a very general email, and I would therefore like to be able to answer only very generally. But this active ingredient has a significant influence on vitamin D metabolism. And right here in the channel QS24 TV we have already done a lot of shows with such sizes as Professor Spitz and many others to clarify you. Without vitamin D, it is not a necessary vitamin, but a vital vitamin. And I have to correct myself immediately, because it is not a vitamin at all. A vitamin is a so-called cofactor for many crucial biochemical reactions, and I have to take it with me. I cannot take this vitamin D with me, but it is so important that the body forms this hormone itself. And it forms it in our liver. Yes, But the attack of a cholesterol synthesis is currently not as strong as in the last 20 to 30 years, in which we try to mass-produce cholesterol. For my terms, this is something that is also in the responsibility of a doctor. That means I have to know very well, and especially with your daughter, what the vitamin D level is like. And it is not about the vitamin D level 25OH, the hydroxy, the inactive, which is formed from the cholesterol of the liver, but is then activated by the light of the sun. And it is transferred to the active vitamin D by means of the liver and kidneys. There are a lot of so-called vitamin D receptor blockades. That's where we classify autoimmune diseases today. And people who have autoimmune diseases, be it scleroderma, be it white-collar disease, be it Hashimoto's disease, be it MS, sclerotomy, there are now more than 150 to 200 autoimmune diseases already classified. I repeat myself sometimes, but when I was young, we were looking for a person in all of charity. We wanted to introduce him to a Hashimoto's disease, i.e. an autoimmune scleroderma disease, which was not possible. All of this, and we have known this for several years, is a disruption within this vitamin D metabolism of the liver. At the moment I cannot answer the question why this has happened, but we go and have to answer these questions. But if we don't know this now, even with your daughter, where there is a clear disruption to the vitamin D metabolism only by medication, then we cannot expect that the mitochondrial performance, there are hundreds of thousands of immune reactions, and especially the reading of the gene information is dependent on vitamin D. These things are of such great importance that you have to promise me that you will have your daughter check the vitamin D metabolism, i.e. vitamin D25OH, vitamin D1.25, and the free vitamin D as well as the vitamin D receptors. Then a corresponding higher dose of vitamin D must be given here, and it must be tried to improve the receptor binding ability. The other thing is that phylacterol and the anti-epileptic agents also have an effect on the folic acid. The folic acid is vitamin B9. Vitamin B9 is important for all cell divisions, especially in our mucous membranes. The mucous membranes are the first gateway to our body. The mucous membrane immunity must be immensely active and large. Vitamin B9 is important for blood cell formation in the bone marrow, i.e. for all processes, and it is responsible for the conversion of homocysteine. That means that if I convert methionine, only a really toxic intercellular product of homocysteine is created, which we of course also see today not only with phenytoin and anti-epileptic agents, but also when I take the pill. These are long-term consequences. If you do not take B vitamins and make a birth control, then this will also have long-term consequences. Your body is only more or less limited with this overdemand, able to compensate for this. This is also the acetylsalicylic acid. How many people just take aspirin? A little bit of headache, a little bit here, just aspirin. These are all the water tablets. These are the immunosuppressants like vitamin B or the immunosuppressants like MTX. But there are also many other things like constant diarrhea or drinking alcohol or many, many other drugs. So folic acid plays a big role here, and you can control something like that. Because if the folic acid, the inactive form, is not converted into the active one, there will be a disturbance again. Phenytoin, the antiepileptics, are used to disrupt this process. And where am I? How is my active folic acid? Or do I perhaps now also have a folic acid receptor weakness? This must be discussed with a doctor who is really experienced in this regard. The other thing is the biotin, the vitamin H. I think you all know this. If you now have a loss of very strong hair with hair loss, because of course as a cofactor within the framework of mitochondria, so mitochondria are our energy forces. If there are disturbances in the biotin metabolism, then ultimately I cannot fix the CO2, the final product of the metabolism, enough. And it is a key vitamin within the framework of gluconeogenesis. That means if the sugar is removed in the liver and kidneys, it is responsible within the framework of the fat metabolism. And it is precisely because of the phenytoin that an increased renal excision is triggered, which then often also has deficiency symptoms in the biotin metabolism, such as growth disorders or mucous membranes problems. Biotin deficiency can also sometimes produce vaginal cramps or also intestinal cramps. In the past, it was observed that children with biotin deficiency also developed worse. They developed delayed within the framework of the mental, i.e. the language, and also showed various disturbed immune reactions. These are things that I believe are of great importance at the moment. To really compensate for these micronutrient deficiencies. And one more thing I would like to point out, because it is not only the valproic acid that is responsible for the loss of carnitine, but it is also about a clear vitamin B1 deficiency, which is responsible for phenytoin and other anti-epileptics. But this vitamin B1, this thiamine, is responsible as a stepmaker for the cellular changes in carbohydrates and energy, i.e. the body and purely the nerve cells need carbohydrates and sugar. And if the neurotransmitter in the nervous system is disturbed or the signal transmission is disturbed by this B1 deficiency, or the metabolism of the neurotransmitters is disturbed, this is a completely different approach to an epileptic event. I will talk about lithium in the context of the next Visite programs. Lithium is one of the most valuable and important trace elements for the brain. And these are processes where lithium regulates the corresponding neurotransmitters. The glutamate receptor, and thus does not allow too much and does not stimulate too little. This low-dose lithium of 5, it is still a child with 17 years of age, up to the adult, can make a significant improvement, especially in the context of epilepsy and also in the context of the micronutrient situation. You mentioned that there are disturbances in amino acids. That is exactly the same, we know that. Due to the micronutrient deficiency, there is a lack of leucine, isoleucine, various amino acids. These are things you can look up on the internet. It is very nicely listed. Where can you find which amino acids in which food are very well represented? I think this is the most valuable option to create a valuable balance. But on the other hand, it is about adding the 8 essential amino acids. And this too much may not be too much in the intake, but a too low depletion. And due to the micronutrient deficiency, a too low depletion. Not just build-up, but a too low depletion. Or a too rapid depletion. Essential means we have to take it, 8 amino acids, so that the body can build up another 22 amino acids. And for the viewers who do not know, the amino acid is the basic component of the protein. So I eat protein, meat, sausage, fish, cheese, quark, yogurt, milk, egg, or quinoa, beans, all vegetable proteins like lentils and so on. But the body must be able to split up this protein from the gut. Of course, by means of enzymatic force. And then there are the 8 essential amino acids, from which the body, in the context of an anabolic metabolism, so-called build-up, now follows its bodily obligations. That's how life is organized. And if you intervene there, if you slow down the build-up, if you slow down the absorption, the resorption, epilepsy also has something to do with a healthy gut. I also ask you to do a stool test for your daughter, because of course we have to know to what extent the gut also has an optimal split-up of protein. To what extent the liver is far too overloaded in this process. To what extent there is a great imbalance within the bacterial world. We are talking about a so-called microbiome. Are there fungus strains and are there highly pathological germs that suppress the healthy germs? If we talk about a leaky gut syndrome in your daughter, if we talk about an inflammation of the mucous membrane, then not only the barrier between the gut and the body is open, but also the barrier of the blood-brain barrier is open. We are also talking about the open brain barrier. These are very, very important questions that you really have to clarify. And again, I think, beyond a neurologically highly specialized exact. Every department is electron microscopically exact, but she has lost sight of the person. She no longer understands the connections. Then you will not be able to understand a disease picture in any way of all its trigger points and also influence it in a form that makes it vulnerable and where she also has a chance to really live the epilepsy once and for all. It is important to focus on the gut. On the other hand, I also ask you, she is 17 years old. A lot is happening with the wisdom teeth. Especially the wisdom teeth are heart and intestinal meridian teeth. I think they have an immense influence on the energy meridian in the supply of the brain. We have simply already experienced that the wisdom teeth, which may now be in a position where they have no chance of getting through, but that again significantly triggers. And apart from that, I would not forget to say to you again, they are really neurotoxins. It is also important to look at how far our child is neurotoxically burdened. She was in her mother's womb for 9 months. That means, if you didn't even have a filling at the time, they have already gone over it. Then you should really go through a chelate test or a heavy metal scan, an oligar scan, get a picture of it. Are we even talking about a toxic burden here? In addition, we live in a time when our environmental toxin number 1 is aluminum. No one is talking about an imminent environmental pollution. If you live in a very rural area, you will also be affected by this talk. If you live in the city, you will still be burdened with traffic and autocadmium. All of this is important. And in the context of their detoxification performance, they have been significantly, also since the 4th year of their life, weakened in the context of their liver metabolism due to the trinity of their medication. These are things that are very important to me. It is very important to look at these children or people who suffer from epilepsy. Do you take gluten out of your diet? We see today that gluten significantly triggers the inflammation in the brain. In the past, children were only treated with a carbohydrate reduction, i.e. low carb. This is the top message for anyone who suffers from epilepsy. And so you can actually start immediately with a lot of other things to integrate a better balance here. Please clarify the micronutrients. Don't just take it in. Certain doses also have to be adjusted individually. Please don't forget to look at Q10 and carnitine, because it's about the energy change of the cell. It has to be supported. And finally, just a word, also a little bit for the sake of completeness. Please also think of parasites. Of course, what we see today are parasites like toxoplasmosis. This is all also brain-related. These are intracellular or single-celled parasites. There are plasmodiums. These are carriers of malaria. And there are swine fever worms. The pork tapeworm can produce cysts. Today, we are partially approaching toxoplasmosis by determining the immune globulin, IgG, IBM, or by conducting a lymphocyte transformation test. It would be important. It is important to perhaps go into treatment who can measure energetically to then also recognize such loads. Or to exclude them, please. That would be very important to me. I now refer again to the so-called CDL manual by Antje Oswald. And I also refer to CDL by Andreas Korka. Please read it, get informed. I don't want to say more at this point. But you create a high and good antiviral, antiparasitic and antibacterial coverage of possible loads without attacking the healthy microflora, without attacking the healthy microbiome. In this sense, I would like to thank you very, very warmly for your request. For all the people who are now in a similar situation, please treat your child's epilepsy in a way that we have not been satisfied with for 20, 30, 40 years. We know so much today about all the things that arise. In the end, it's called epilepsy. Sometimes we can only bring the children into a very vulnerable situation. And I think there is a lot to do. And nothing, but also nothing in the world is more important to us and is higher than the health of our children. In this sense, thank you very much. Whenever you have any questions or want to need my medical advice from a holistic point of view, feel free to write to me at visite@QS24.tv. I really enjoy it very much. What I enjoy even more is that I know what fertile ground I can lay on. I can feel the resonance of life, the exchange of resonance with each other. Thank you very much for that. Have a good time and I look forward to the next Visite show. Thank you.